Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the congenital glaucoma, we have secondary congenital glaucoma. So, what are the causes of secondary congenital glaucoma? So, first causes. Okay. Causes of secondary congenital glaucoma are congenital glaucoma associated with iridocorneal dysgenesis. This involves certain syndromes like Axenfeld anomaly, Rieger's anomaly, and Peters anomaly. The secondary congenital glaucoma associated with iridocorneal dysgenesis includes Axelfield anomaly, Rieger's anomaly, and Peters anomaly. It can be associated with aniridia, and the secondary glaucoma is also associated with ectopia lentis. It is also associated with nano-ophthalmos, nevus of Otto, and also Loeys syndrome. Then it is also associated with certain phacomatoses, like it is associated with Sturge-Weber syndrome, and it is associated with von Recklinghausen's disease. So these are the different causes of secondary congenital glaucoma. That is the congenital glaucoma occurring due to other diseases.
thank you and thank you for watching.